There were 3 known conversions into HIV positive amongst their patients, and they were shut down in 2018, and the owner pleaded guilty in June of 22 to 5 felony counts of practicing medicine without a license. She actually had no license to practice of any kind, and she was sentenced to 3.5 years in prison. This is Med Spa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate Dee. Together, we explore the wild west of medicine that is the aesthetics industry. Today, we explore PRP, or platelet-rich plasma, how it's obtained and what it can be used for. Though this is generally a safe procedure, some very bad outcomes have happened, including the spread of HIV infection and some cases of blindness. Find out how you can benefit and avoid disaster. Hi, I'm Dr. Kate Dee, and I'm here with Dr. Judy Rubin, and today we are talking about the vampire facelift, or PRP, and the use of PRP and PRFM for facial rejuvenation and other things. Judy, thanks so much for being back.
Thank you so much for having me.
So I wanted to just let people know first what the heck PRP is and why some people call it the vampire facial or the vampire facelift. So platelet-rich plasma is PRP. And what that is we use plasma and platelets taken out of your blood, and inside the PRP are a whole bunch of growth factors and cytokines, things that promote healing. And we can actually use those growth factors to rejuvenate the skin and lots of other things. Judy, do you want to describe some of those other things that we do?
Sure. Well, you can use PRP for osteoarthritis. You can inject it into joints, and it has been found to be very helpful for osteoarthritis. We use PRP for the O shot, which is the orgasm shot. And we use PRP for the priapus shot, or the P shot. We also use PRP for facial rejuvenation. We microchannel PRP into the face. Or you can mix it. You can mix it with calcium and make a gel.
Yeah, so we use PRP, and when you mix it with calcium or you activate the PRP, it becomes platelet-rich fibrin matrix, or PRFM. And we use that quite frequently to treat tear troughs, meaning the under eye area. And you can use it elsewhere in the face to do direct injections. And rather than PRP, so PRP itself is liquidy and it kind of spreads out. When you inject it, the growth factors kind of spread out. Whereas with PRFM, it turns into a gel in about 8 minutes. And so when you inject that, it kind of gels inside the body and then acts as a depot for these growth factors. So we have been using that quite a bit for the under eye area in particular. We also, for many years, were using PRP for treatment of hair loss. And although those treatments have evolved since then, we can talk a little bit about how that works. So yeah, PRP was originally developed for orthopedics. So it was actually used in the 1970s for knees and hips, and still is. And I myself had tennis elbow about a year and a half ago, and the number one treatment now for tennis elbow is PRP more than steroid injections, believe it or not. So that's a very, very popular and actually growing in the world of orthopedics, especially now, way more than it was maybe 9 years ago when I started doing PRP procedures for facial rejuvenation. Have you ever had a PRP injection for joints or anything for you?
I have osteoarthritis of my knee, and I like to hike. And I like to hike on waterfall hikes. And when I would hike down from the waterfall, I had a lot of pain in my knee, and I went to see my orthopedic surgeon, and he did a PRP injection. And within 3 days, it started feeling better. And that singular PRP injected lasted for 3 years.
Wow. So that's
Single
awesome.
breast,
Yeah.
yeah,
I mean, basically, PRP will stimulate growth and healing inside your body, and it can't magically fix things that are permanently torn or broken, but it doesn't really stimulate new cartilage to be built, but it will help healing. Anything that's able to heal, it will promote healing. And for facial rejuvenation, which is how I got started in this, what happens is we tend to do, say, microneedling, which, you create little channels into the dermis where the collagen and elastin get built up by your little cells called fibroblasts. And as you get older, those fibroblasts that make collagen and elastin really go dormant and they stop doing anything, right? But if you feed them some growth factors, they can wake up and make collagen for you. And that can actually prevent that thinning out of the skin that you get as you get older. So in my practice, we really recommend doing something or other to wake up your fibroblasts and make collagen for basically everybody over 30, because by the time you're 30, those cells are pretty much dormant. So with a PRP facial rejuvenation, what we're doing is we're taking the PRP and we are allowing it to get into the skin through these little channels that are created by microneedling. And the other component of that facial rejuvenation is you can directly inject that PRP into any area where you've got more wrinkles or scarring or volume loss, any place that you want to concentrate your growth factors. In our case, we often will do tear troughs or the nasolabial folds or the marionettes or, areas of scarring in the skin. What about you? Do you do much PRP facial rejuvenation in your practice?
we do PRP microchanneling with Aqua Gold. We do PRP for hair loss, and I've seen fantastic results. And we will infuse PRP with our radiofrequency microneedling machine, Potenza. It has an infusion tip. And so we can put PRP basically anywhere in your forehead, in your glabella, around your eyes, in your tear troughs, on your neck, in your elbows, on your knees. Because it increases collagen and elastin by stimulating the fibroblasts to create collagen and elastin. And it's
Right.
using the body's own mechanism to heal itself.
Right. And so basically, you're using your own growth factors from inside your blood to stimulate healing or, collagen and elastin synthesis in your skin. So the reason that some people call it the vampire facial or the vampire facelift is because this was made famous by Kim Kardashian. She very famously talked about this back, I believe, in 2013. She went to this doctor called Charles Runnels, and Charles Runnels trademarked the term vampire facial. And he created a whole business training people and then charging them monthly to use the term vampire facial. So if you haven't been trained by him and pay money to him, then you can't use that term. So I never did that. I learned this technique back in 2015, and I call it PRP facial rejuvenation. I don't call it the vampire facial. But there are plenty of people who do, and it's the same thing. So the treatment is the same. And actually, in different people's hands, they kind of do different things. They have different kits that they use. They have different ways of creating the PRP. But essentially, what you're doing is using growth factors from your own blood to stimulate collagen in your skin. So I believe that Kim Kardashian and Charles Reynolds had a little bit of a falling out. I'm not totally sure, but I believe that he really tried to monetize her fame in order to promote his business. And I think he was quite successful at that. And to this day, he continues to train people and promote people using that terminology. And also, he is the originator of the P shot and the O shot. So I'm assuming because you use those terms, because we do not do those in our practice at Glow, but tell me a little bit about those and how you learned how to do that and your experience using PRP for that purpose.
Yeah. So, I mean, we do a lot of work with women who are in menopause, and as you get older, the clitoral nerve, doesn't function as well, and so patients experience a quality of climax that's not as good as it was when they were younger. So I happened upon the O shot, and I'm a reader, so I like to read everything and make sure that it's going to work, it's efficacious. And the only way to learn about the O shot is to either watch some videos on, pay for the training and watch some videos, or go to a live session and learn firsthand from somebody. So I chose to watch the videos. To watch those videos, you have to pay, I don't remember how much money. And then you watch some really bad videos, and you can go ahead and use the term O shot. It's actually a very simple procedure. You make PRP from a FDA approved kit. I use either Regen or Eclipse tubes. You maintain sterile technique. You numb the patient, and then you inject for the woman into the G spot, and then 1 cc into the clitoris. The injection into the G spot is activated, so it's PRFM. And for the man, you inject PRP, 5 different shots, a third of the way down the shaft, a third of the way from the glands up the shaft, and then at the corona on the glands.
And what kind of results do you see with the P shot and the O shot?
The results are fantastic. So women who are not able to reach climax can climax again. Women who had multiples before and no longer can have multiples again. You forget that you've had it until several weeks later when you are being intimate, and all of a sudden you're like, oh, I remember. And it's painless because we believe in anesthesia.
Right. So then do you have some people who do both the O shot and then also vaginal rejuvenation, which we talked about in the last episode?
Yeah, we do. I mean, because it's the same age, or even women who are premenopausal. Lots of times they'll come in for a Mona Lisa vaginal rejuvenation and then an O shot. And then I have my patients with lichen sclerosis, which is a really mismanaged, undertreated disease. It's an autoimmune disease, and most patients come in and tell me they've seen 4 or 5 doctors who didn't know what it was, and then offered them a treatment of cortisone and
Can you explain to our audience what that is and what it does to you?
What lichen sclerosis does to you?
Yeah.
It forms a plaque on the lining of the vagina, and it is very, very painful and irritating. It's hard for me to explain because I don't have it, but I certainly have many patients who have it, and they tell me that they're always uncomfortable, they're itchy, they feel like there are fire ants inside of their vagina, and they are just very uncomfortable. Yeah. And they all tell me, uniformly, all of them have told me that they have been to multiple doctors who didn't know what it was. And the incidence is 0.03. The rate is like 0.03 per 1,000. So it's not very common.
Right.
But it's very uncomfortable. And so I had these patients who were coming to me asking for Mona Lisa, asking for PRP, and I went to PubMed, as I do with everything, and lo and behold, there are many articles that talk about both of them. And I've treated probably 20, 25 patients with phenomenal outcomes.
Okay, that's great. That's awesome.
Yeah.
The one thing we haven't quite talked about yet is PRP for hair loss. And I can say that I've been doing that for a very long time. And I'm interested to know your experience. For me, I started doing PRP for the face back in 2015. And at some point around then, I had a patient who came in who'd been researching PRP for 2 years at that time and knew she wanted it and was busy interviewing basically everybody in Seattle who did PRP at the time. It was kind of a long time ago. Not a lot of us were doing it. And she decided I was going to do her PRP for hair loss. And she was in her 50s, African-American, nurse midwife, very smart. And she was like, well, you're going to do it. And I'm like, well, I don't know anything about that. I'd need to do my research. And she's like, well, do your research and I'll be back. And so I did a bunch of research. And at the time, there wasn't a lot of data, but there was one guy in Florida who had published his own data stating that the success rate at the time was about 75%. And there were a number of people who were writing about it, anecdotally about how it really helped them. So, and I had the equipment, so I could do it. And I was like, okay, I will learn how to do this. And she's like, okay, good, let's do it. And her case is pretty bad, actually. And we did one treatment, and I'll tell you, it's not so easy to numb the scalp. So that doesn't feel good, having injections into your scalp. At the time, there were two different techniques, one of which was dominant back then, which was to do it, microneedle it in addition to direct injections. Over the years, that became supplanted by just direct injections without microneedling. But either way, it's not pleasant. But anyway, she had a really phenomenal response from just the first treatment. She had not only more hair, but the hair that was growing in was a dark, and she had had a lot of gray, but the new growth she was seeing after the treatment was dark hair, and it was pretty awesome. So she was very happy. We did a few more of those, and I thought, okay, I guess I'll, do this again if someone asks me. And over the years, I've had many, many patients, and it works pretty well. I wouldn't say that it's 100%. I would say I would give it more about 80% success rate. And then it's variable too, as to how dramatic the response. Sometimes it's mild, sometimes it's pretty dramatic, like that first patient. And then for me, well, I'm curious to know what your experience has been.
I'd say it's identical. How often do you do PRP for hair loss? And do you give
Well,
them
now
anything else?
we really have moved away from doing it. At the time, we would do it every 4 weeks or so, for a total of at least 3 to 6 treatments. It kind of depends. What I would tell people is you're going to know, because you're going to start to see the little baby hairs, right? And oftentimes it's really the person who cuts your hair who will notice. You might not even be able to see them if they're up at the top, but like the person who cuts your hair will be like, oh, wow, look, you got a bunch of new growth now. And that takes at least 3 months to see, because the little baby hairs, you can't see them when they're really tiny.
Yeah.
So I would tell them at least 3 treatments, but typically, we would do 6. And you would start to really see those little baby hairs around 3 to 4 months.
Yeah, I would agree with that completely. I have some patients who I've been treating now for 3 years. In the beginning, I would do it time zero, the time zero, 1 month, 2 months, and then I would do the fourth one at 7 months because that was the protocol. And now I found that I do that same protocol, but I also inject them every 6 months. And I have some patients who are 3 years out, and the hair growth is just amazing. And it wasn't always so. So sometimes they didn't respond as well as I would like them. It was really hard to see the little baby hairs. But if you just continue doing it every 6 months, it really starts to increase.
Yeah. And so what happened in my practice is that there was a company that was called Carifactor, and they made a kind of essentially a bioidentical set of growth factors that are the same as what you would get out of PRP. And one of the issues that was thought to be the problem with PRP, why some people just didn't respond, is that your set of growth factors in your blood is variable. And it's variable day to day, and it's variable month to month, and it's variable person to person. And so there in your blood, there are some growth factors, and there are also some things that inhibit growth of hair. And so the thought was the inhibitors sometimes are too much, right? So this company developed these bioidentical growth factors that they put in little nano lysosomes and put in a vial that was sterile. And you could use that. They made a shampoo and a leave-in treatment, and then they used a very highly concentrated serum to be put on the scalp. That company got bought by another company, Lutronic, that owned this laser that is used to increase the permeability of your skin for various topicals. And their idea was to use the laser first at a very low setting and just increase the permeability of your skin, and then put the care factor on. And that way, one, you don't need a blood draw, and it's much less painful. And the care factor, which was designed to be absorbed pretty well to begin with, was, the fact that the laser was available increased the absorption by 7 times than just putting it on the skin. So we started doing that, and we found that our results from the Cara factor plus the laser kind of treatment was about the same as PRP. It wasn't better, but it wasn't worse. And I will tell you, having had both done to me, way less pain with the laser treatment. I mean, there's just no pain, basically. It's a little prickly. It's no big deal. So we started doing that. We've been doing that the last few years. And then more recently, just in the last few months, we've been using another topical product that has exosomes in it. They're platelet-derived exosomes. The company's called Rion, and they make the product called Plated. It's called Plated. And we've been using that as a topical in order for, stimulating collagen with a topical. And they just came out with a hair serum. So jury's out on that. I started using that personally like a month or two ago, but I haven't used it at all really, other than personally. I don't know if that's going to become a thing or not. But my idea would be to try the laser and then the plated and see if that did it, because the plated exosomes are like many orders of magnitude more powerful than PRP. And so if you could harness that and use it, that would be amazing. I just don't know that it works yet. I have no idea.
Yeah.
So
you just have to worry about hair shock. If you don't have the right number of platelets in your tube, you want like 2 to 3 times normal, or what's in whole blood, then you can put the patient into hair shock. So I don't know. I'm going to look at that.
And what happens with hair shock?
You lose your hair.
Are you using that to be the same as telogen effluvium, or is that what you mean by hair shock, or what do you mean by hair shock?
The hair sheds. It will come back, but you will lose clumps of hair. And I've never had it happen, so I've never seen it.
I was going to say, I've never seen that either.
In the literature, the literature is very clear that you should use an FDA-approved tube so that you do not get hair shock, which is why I use exactly that, and I know you do as well.
Yeah.
And so
let's talk about that a little bit. So the use of, I also really recommend never go to somebody who's doing a do it yourself kit. It's not that that's illegal or, unethical even. It is definitely a way to save a lot of money because these kits are very expensive. But it's also a way to introduce human error into something that's already been like sterilized and perfected. So I don't know why people mess with that. So it is pricey, but basically we use the cell-fill system. And my understanding is you're using Eclipse or Regen, both of which I've used in the past. They're excellent, high quality systems. I switched to cell-fill because there's 2 tubes that come with it. So the first tube you get PRP, and then you can use the second tube to activate it. And so it's all closed and sterile, and you don't have to worry about any transmission of anything bad. We know I would really like to make sure everybody learns about this. There's a couple of, so PRP in general is very, very safe. But there are a couple of bad things that can happen. There was a clinic in New Mexico, it was called VIP Spa. And in 2018, this was shut down because they were doing PRP procedures and spreading HIV around to their patients. So there were 3 known HIV cases. There were many more people who are exposed, but there were 3 known conversions of into HIV positive amongst their patients, and they were shut down in 2018. And the owner pleaded guilty in June of 22 to 5 felony counts of practicing medicine without a license. She actually had no license to practice of any kind, and she was sentenced to 3.5 years in prison. So at least that outcome, there was actually an actual legal enforcement,
Yeah.
because it's just horrendous, right? I mean, back, when we were going to med school, that would have been a death sentence. I mean, luckily now that she didn't actually kill those people, but that those people have a chronic deadly disease now that they didn't have to have from a unauthorized, illegal practice of medicine by someone who didn't know what they were doing. And obviously, we've been trying to figure out why did those people? What was she doing? Because you'd have to cross contaminate people, reuse syringes or reuse needles or reuse tubes. Who knows? That sounds so crazy to me.
Yeah, you can't reuse the tube. I mean, I've never thought
No.
about it, but you can only use it once. So they had to reuse needles or syringes. But that's why it's so important to see someone who is adequately trained and licensed.
Yeah. So again, for those of you out there who are thinking about doing one of these procedures, and of course, we both think they're good procedures, right? You want to make sure you go to somebody who is legally allowed to practice medicine, which generally means a doctor or a nurse practitioner in some states, and or a PA who works for a doctor. But everyone else, it's really not legal for them to be doing this stuff on their own, right? Least of all somebody with no medical license whatsoever. In researching for this podcast, the other complication that I found that it really shocked me was there were 4 cases reported, and as far as I know, these are the only 4 cases that were ever reported ever of this complication from PRP. But there were 4 people who had blindness in one eye from direct PRP injections into their glabella, which is the 11s, the vertical lines between your eyebrows, which is an extremely dangerous place to inject. So we don't ever inject anything there, PRP or filler or anything in the glabella, because there are branches of the retinal artery that connect with that area. So God forbid you get it in an artery, you could blind somebody. But there were actually 4 cases that I could find of blindness from PRP injections. So again, if you are having PRP directly injected into your skin or anywhere, you want to make sure that the person who is doing it knows what they're doing and is not taking any kind of chances like that. Most people I know would not inject filler or anything else into this area between the eyebrows, because it's such a dangerous area.
Yeah, you have to know what you don't know. And the problem is that when you don't have adequate education, you don't realize that there are arteries in the forehead. I mean, there are arteries everywhere on your face, and you need to know where they are, and you need to avoid them.
Yeah.
And PRFM, sometimes people say it's safer than using hyaluronic acid or a filler that is created by a company, but in the right hands, it can cause blindness.
Yeah. I mean, it's unusual. So PRP is a liquid, and it is your own serum. However, it's filled with platelets, which do cause clotting. Like, that's what they do. So there's a potential that they could get into of artery and block it. I was really surprised to find this reference in PubMed, but again, we would just absolutely never do that. And PRFM, just so you know, it does turn into a gel after you inject it. It takes about 8 minutes. At least the system that I use takes about 8 minutes for that to turn into a gel. So when we're injecting it, it's still a liquid. But once it's in there, in a few minutes, it's turned into a gel. But it's not without its risk. So super important to make sure that you're going to somebody who's not cutting corners, not doing it themselves, using a real FDA approved product, and has the kind of education that they know what's safe and what's not safe. In the last week's episode, we talked about one MA and an esthetician who were injecting filler into people's noses. And I can't even fathom doing that myself. We send those cases to an ENT specialist who does it under ultrasound. But basically, when you don't know what you don't know that you're taking a giant risk with someone's life or their face or their skin. So the other thing I would like to emphasize too is maintaining sterility and what that means. And I can tell you, I'm curious to know what happened with you when you're in med school. But for me, when my very first rotation in the third year of med school was in surgery, and we learned about how to scrub into surgery and how to keep your hands sterile, even if you were only holding a retractor. And God forbid you moved your hands 1 centimeter too low, the OR nurse would scream at you and send you out to the OR, and you got to re-scrub. And that took about 10, 15 minutes. So it's a really big deal knowing where are those bacteria, what's your sterile field, how to treat every little thing to make sure you stay sterile. Because in an outpatient setting, we are not in an operating room. We have to create a little sterile field and know how to keep it sterile. And that's actually not so easy to do. And so I would venture to say that most of these people who didn't, they're not a nurse or a PA or a doctor. They have never been yelled at by an OR nurse to go rescrub. And there's no way they have the, keen awareness of what it means to maintain sterility and make sure that there's no contamination.
Yeah, every doctor is taught how to maintain sterility, to be aseptic. And there's the sterility that you learn in the operating room, but then there's also the sterility that you learn for office-based procedures. And it's not a concept that I think people come to easily, but something that is just the way of life for us.
Yeah, it's a very difficult thing to teach people unless it's been sort of stomped into their brains. So this is definitely something that people who are not medically qualified really should not be touching any blood products, which is why, in my place, there is no esthetician, no MA would ever touch a blood product, that it's always handled by somebody who knows what they're doing. And I think, unfortunately, if you go somewhere where they do not maintain this kind of sterility, then you have a much higher chance of infection or, God forbid, transmission of something like HIV. That'd be just the worst possible outcome. So we've talked a lot about the pluses and minuses of PRP procedures. I personally think that they're excellent. We do a fair number of these things in our practice still. Some of them, like the hair treatment, has evolved. We also have way stronger things for facial rejuvenation, and you and I have talked about that in a previous episode. So if you really are looking for skin tightening, PRP is not your answer. RF microneedling, which we've talked about before, is definitely like a more powerful thing. But for a lot of people, maintaining collagen and treating certain things like tear troughs, it's a really fantastic option. And then, of course, if you want a bigger orgasm, have a no shot. All right. Well, thank you so much for being with me today. It's been really great talking with you. And hopefully you'll come back again in the near future for another topic.
Yeah, I look forward to our next topic. Hopefully there'll be one soon. And I always enjoy these podcasts.
All right, great. Well, have a really great day. We will be back here soon.
Okay. Bye-bye.
If you have a question or a crazy story of your own that you'd like to hear on Med Spa Mayhem, contact us through our website, medspaamayhem.com, or check out our contact information in the liner notes. If you learned something today and like what we're doing, please give us a 5-star rating and read the book. Med Spa Mayhem is coming out June 11th, 2024. The link to pre-order is available on medspaamayhem.com. I hope you've enjoyed our conversation about PRP and PRFM. We're always looking for ways to explain the good and the bad, and sometimes very ugly realities of the med spa world. Make sure you ask the right questions before having any of these procedures, and make sure you're working with an expert professional. This has been Med Spa Mayhem with Dr. Kate Dee. We are so grateful you're listening, and we hope you've learned at least one fun or possibly disturbing fact today. Don't forget to subscribe and leave us a 5-star review. Oh, and read the book. Med Spa Mayhem comes out June 2024. Available everywhere books are sold. You can pre-order now on Amazon, Barnes & Noble, and at bookshop.org. Links and more can be found on medspamayhem.com.